We're going to now turn to our final session for the symposium. So I'd like to introduce our Student Research Showcase presenters, who are Joanne Rack, Sofia Al Balkhi, and Emma Ruby. They're going to be presenting about findings of a scoping review that's been done looking at Canadian midwifery research. So back to introductions. Emma Ruby is a first-year medical student at the University of Ottawa, and she's been working with the McMaster Midwifery Research Centre as a research assistant for the past year. Prior to starting medical school, she completed an honors thesis project under the supervision of Dr. Beth Murray-Davis, which allowed her to explore clinical health research in the field of non-communicable diseases in pregnancy. Joanne Rack is a practicing midwife and research assistant at the McMaster Midwifery Research Centre and a PhD candidate at Bournemouth University in the UK. Her current research interests include understanding strengths and gaps in Canadian midwifery research, risk communication in pregnant people of advanced age, gender-inclusive language in sexual and reproductive health, and the prevention management and management of PPH. And Sofia Al Balkhi is a practicing midwife with the Community Midwives of Hamilton. She's a current graduate student in the midwifery master's degree here at McMaster, and she previously worked at the Orford Centre for Child Studies as a research assistant and coordinator for over 6 years. And she'll combine her previous experience working in the field of mental health with her midwifery clinical experience. Her research interests include working with Arabic-speaking clients and determining mental health outcomes for clients in midwifery care. So welcome, Joanne, Sophie, and Emma, and please go ahead with your presentation.
Okay. Well, welcome to our presentation. We are sharing the preliminary findings from the first phase of the Canadian Midwifery Research Priority Study, the Scoping Review. And this scoping review is the first part of a larger CIHR project grant that will develop a comprehensive map of the field of Canadian midwifery research. There's plenty more to say about the next phases of the larger project, but today our focus is going to be on the results of the scoping review. The scoping review was undertaken to identify the types of evidence that are being produced and the intended audiences for Canadian midwifery research. It's expected to yield important insights into the areas where midwifery research focuses and identify gaps where inquiry has yet to explore. This is going to aid future midwifery researchers and current midwifery researchers in identifying research priorities going forward. So although the larger CIHR project involves an expanded research team of contributors and authors, this phase of the project was led by PI Beth Murray-Davis with a team of co-investigators, authors, research coordinator, as well as myself, Sophie, and Emma functioning as research assistants. So why are we doing a scoping review? So this study is in response to the question, what is the state of midwifery research in Canada? And what types of midwifery-focused research have been reported specific to a Canadian context? So currently there's a lack of understanding, and as a result, we're mapping the Canadian midwifery research to create like a research history for us. So we're answering the question of what the state of midwifery research is. We are interestingly reviewing research from as early as 1936 up to the recent 2022, which looked at midwives within and outside of Canada who are involved in research. And we're also, it's allowing us to start opening up opportunities to look at Canadian midwifery research a little differently. So for example, at the bottom there, we started doing a little bit of preliminary bibliographic mapping and bibliometric analysis. Okay, so how did we do this? So we used the Quality Maternal Newborn Care Framework as a tool. And this framework was published first in 2014 in the Lancet series on midwifery by a group of 35 different international authors. It was developed to serve childbearing peoples and recognizes the crucial support that midwifery offers families. So the key things in this quote, I think it really encapsulates the kind of the framework and the tenets of the framework. So it really talks about, you know, what care is provided, how it is, and by whom. And then it really is really like developed in response to the Sustainable Development Goals that were being authored at the time. And the researchers really wanted to provide a substantial piece of work to dovetail in with the SDG agenda. Key priorities that we won't see when we look at the framework, but really look at building midwifery research capacity. And so this speaks directly to the CMRP study that we're doing. And this is one of the reasons why we utilize this tool in the process of the scoping review. So here's the framework. And each article was applied to this framework and to guide the categorization. And even though it seems fairly explicit, when we were applying these categories to the research, we discovered that further definition was needed for a Canadian midwifery context. And so we created a working document and adapted this tool a little bit for our own use. Initially, articles were read and considered for categorization based on the primary focus of the article, and was placed into one of the 5 category practice categories that you see like on the right. I guess it would be the left-hand side for you guys of the screen. And in the case where an article was within that first practice category, you needed to further stratify it. And so there were 3 main themes. And I'm going to give you some examples of how we kind of use the articles. So for example, the first one, education, information, and health promotion. These would include research associated with things like family planning, infant feeding, or pregnancy-centered nutrition. And then the second category, assessment, screening, and care planning, would include research that was focused on blood pressure, monitoring, GBM screening, screening for infectious diseases, and mental health. Promotion of normal processes and prevention of complications. These things would be like encouraging mobility in labor, articles that would be focused on water birth, or just normal care of uncomplicated labor. First-line management of complications would look at things like we would include things like breech or ECV or postpartum iron deficiency. And then when we look at the medical, obstetric, and neonatal services, we're really looking at things like small for gestational age babies, planned or elective cesareans, and infants with known or unknown complications. So studies in addition to this were categorized in terms of clinical or non-clinical papers, as well as where they focused across the continuum of childbearing.
Okay, so moving on to our methods. So as Joanne mentioned, this review was part of a larger ongoing study to explore midwifery research in Canada. So initially, a search strategy was developed in consultation with research team members who had scoping review expertise, and this search strategy was applied across 5 different online databases. To consolidate the articles obtained, we used Covidence software, and this is where we had duplicates that were filtered and removed, and we applied our selection criteria, and we went through various rounds of screening, including title and abstract, as well as full text. So inclusion and exclusion criteria was based on authorship, country of association, study populations, and type of research. Articles were excluded if they were not primary research or if it was research that was conducted by non-Canadian, non-midwives on non-Canadian or midwifery populations. So data extraction was conducted in Covidence as well, using the adapted framework that Joanne outlined. And along the way, we employed several quality assurance checkpoints, including things like predefining categories of the modified framework to minimize subjectivity, conducting a random sample of the obtained articles using this framework to assess its validity, maintaining multiple reviewer data extraction, and conducting interim analyses with the research team to discuss any questions or concerns. So what were our results? So a total of 590 articles were included, and you can see the Prisma flow chart outlining how we got to that number on the right-hand side. Articles were included from the start of time to the end of 2022. And like I mentioned, this search was conducted in 5 databases, and you can see those on this slide as well. And this was done to increase breadth of disciplines and professions for consideration in inclusion. So upon classification of the articles according to country of research, we found that over 3/4 of the included articles were based in Canada, 13% were international, and 9% included both international and Canadian contexts. So moving on, so what did we find? As highlighted in the graph on the right, over half of the studies that were included were published in the last decade. So this graph also clearly highlights the exponential growth of midwifery research publishing over the last several decades. And then when we analyze the articles according to study design, you can see that's the pie chart on the left. You can see that almost 1/4, so 23% of the articles were surveys, 23% were qualitative, and the third most represented were cohort studies, 16%. You can also see that RCTs were one of the least represented, comprising 3% of the available literature, and systematic and scoping reviews made up 9% and 6% respectively. So evidently, observational and qualitative studies were very well represented, with controlled and experimental studies much less. So what categories emerged? So using the QMNC framework that was outlined earlier, our group categorized each article. And as Joanne previously mentioned, this process was not mutually exclusive, since there were many articles that were focused on a multitude of themes outlined by the framework. So practice categories, you can see that those are in green and pink in the image. Those were the most prevalent in the literature, comprising 43%. So this included a broad range of themes such as screening, health promotion, etc. So within this category, further subgroups included pregnancies with no complications and pregnancies with complications, the former of which comprised 31% of total articles, the latter comprising 12%. Philosophy and values were the two least prevalent categories, representing 8% and 12% of articles. And lastly, organization of care and care providers each comprised approximately 1/5. And lastly, another analysis we conducted was exploring the broader themes of clinical versus non-clinical research. So on the left-hand side, those were our clinical papers, and you can see that the most represented were articles that focused on prenatal and labor and birth themes, and whereas neonatal and postpartum research was limited. And you can see there's almost no representation in the first decade. In the graph on the right, we explored the non-clinical themes of philosophy and values, policy, and educational purposes. So a significant increase was seen in both philosophy and policy research over the past 2 decades. However, educational research has consistently remained low, comprising 11% of research.
Thank you, Emma. So what does this all mean? There has been exponential growth in midwifery-related research in the last decade, which is really exciting. Among midwifery researchers, there is strong interest in conducting research pertaining to 2 categories, practice categories and organization of care. This is unsurprising given that practice categories consist of education, health promotion. So Joanne did a bit of a background on that, and that would include things like breast or chest feeding support, screening and assessment. So for example, STI or mental health screening, promotion of normal processes, and prevention of complications, really core values to midwifery care in the model. Organization of care, meaning that midwifery researchers were really interested in determining how midwives fit within the healthcare system and how we can work towards providing comprehensive maternity care. There were also clear gaps in the research, the first category being neonatal as well as postpartum care. And interestingly as well, there's a gap in the research pertaining to education of current midwives as well as continuing education of future midwives. Okay. In terms of strengths and limitations, this is, I'm excited to say, a bit of a landmark study. It is the first undertaking of mapping out of midwifery research in Canada. And so that's really exciting about this project. It's also one of the first applications of the Lancet QMNC framework. As such, our team really took the time to train on how to use this framework and modify this framework so that it works within our scoping review. And due to our QI checks, we also had high inter-rater reliability, which was great. Now, there are some limitations to our study, given by virtue of it being a scoping review, there are broad research findings that require further investigation. And we're happy to dive into those a little further on in the presentation. And also, the included articles must be in English. So although there was an international focus, there were likely some articles that were excluded from our analysis. Okay, so then what's next? We are really interested in stratifying gaps by year to determine if there's more recent uptake of midwifery-led research, particularly the areas of neonatal postpartum care, as well as midwifery education. As part of the scoping review, we did find articles on Indigenous midwifery and midwifery in Indigenous communities. However, as part of our work and commitment to truth and reconciliation, we really need to take the time to partner with Indigenous researchers and communities, because we are not the owners of this data. They are the owners of this data, and they need to put their stamp of approval on it, but also determine what questions to ask, how the analysis should move forward. And so we're really excited to see if this is an area that we can partner up with. And in terms of next steps, these findings are hoping to inform future research directions. Okay, and so to wrap up, we know that given midwifery in Ontario has been around and regulated since 1994, midwifery researchers are an emerging group. So therefore, more support needs to be provided through funding, as well as mentorship for early career midwives. And by doing so, we might even see more RCTs and a focus on research to fill those gaps that we've highlighted. We're in a unique position, given that the analysis has just started and there are many more research questions that we can address. And so some possible future research directions, these findings can act as a jumping off point and could include more analysis on equity and diversity, expansion into global context using appropriate stakeholders and representation from racialized groups, and further support from racialized midwives and racialized researchers as well. So we're really excited about the current state of midwifery, excited about what future midwifery research will look like, and I think what a note to end our symposium on. Thank you, everybody.
Thank you so much, Joanne, Emma, and Sophie. And we do have a little bit of time for questions if there are any questions from the audience. Okay, so we have a question from Dr. Vadum. Did you look at midwifery engagement in participatory research or patient-oriented research? And did you examine midwifery engagement in health equity research or research that's focused on patient experience? And is there anything you can share with us about those particular areas of research?
As part of this, I guess I could start answering this. As part of the scoping review, we actually haven't started to do some of that deeper analysis yet. We have really focused on the preliminary findings of categorization, but those are all areas for the future.
Great. Yeah, I think it's a great question. Sorry, Emma. Yeah.
We just need to go and do a little more analysis.
Yeah, I was just going to add that Ginny Brunton, one of our co-investigators for this project, she's been working on a secondary analysis looking at patient engagement. So there are some really cool findings coming out of that, and that is currently in the works for being published. So that's exciting.
Great, thank you. Are there any other questions from the audience? Feel free, if you do have any, to put them into the Q&A. And there's just one other brief question, which is, have you published your research yet?
Not yet. Hopefully soon, though. That's the plan.
Yeah. Great. Well, I think, seeing that there are no questions, thank you to the three of you very much for sharing this. And as you said, it really is, it's an inspiring way to end the conference or the research symposium, just seeing the growth that's been happening. And I'm going to turn it over to Beth for some closing remarks now.